Gino Kenny.
Thanks, Chair. Thanks very much. I'd like to thank the regional group for this very important debate. I think it's a very timely debate in relation to emergency services, and also to commend emergency services that continue to provide everybody, emergency kind of, I suppose, cover in relation to if we have an emergency. And we probably all have an emergency one part of our life, and they do a crucial job in protecting us and protecting our families and our friends, and that has to continue. And I think the pandemic has thrown up a huge amount of challenges in relation to healthcare, and particularly around that time. I think emergency services, paramedics, fire brigade, were really kind of pinned to their collar in relation to the challenges that they were up against. And Minister, you will understand response times is absolutely critical for better outcomes, and I think we'll all agree with that. Now, the National Ambulance Service were at the Health Committee last week with the Dublin Fire Brigade, and they kind of stated that there is a huge amount of challenges in relation to staff retention, which is across the board in the health services, capacity issues, and issues that go back decades in relation to resources. And they have stated that demand far outstrips supply. And if you have a situation like that, then you will have worse outcomes for people that need an ambulance at a particular time. So that has to be addressed. All them issues that, as I said, Dublin Fire Brigade and the National Ambulance Service have stated, because if you don't have capacity, then people will die and so forth. So just on another kind of related issue, because obviously when paramedics and fire brigade get to emergency departments, there is another issue in relation to emergency departments in our state. And the Irish Nurses Midwives Organisation have stated this, along with other unions, that there are situations in emergency departments that are just not conducive, not only to patient safety, but also to staff safety. And they've continuously said to the government that they need to address these issues. Otherwise, people will die in emergency departments, staff will leave, and once staff leave and they get demoralised and get burnt out, then you have an enormous problem, because people that have decades of experience won't continue in that environment, and that has to be addressed, because otherwise we'll be talking about this continuously. And the Irish Nurses Midwives Organisation have even said they will go even as far as industrial action in relation to the pursuance of staff safety in relation to not only ED departments but also hospital departments. Minister, that is crucial to address these issues, because if nurses organisations such as the IMO are saying that there is situations they find themselves in that are unsafe in a hospital environment, surely alarm bells will have to ring to address these issues, as I said, retention of staff, to address the underlying issues of capacity. You can't, I mean, you just, I know I've said this many, many times, but I'll say it again. Situations where ED departments, where people find themselves, they go there, obviously they need medical help. But situations that people are hours, sometimes days in trolleys, it's just not acceptable. I don't know how anybody can actually find that acceptable. Ireland is a very, very wealthy country. People have paid tax all their life, and when they need that care at that particular time, they have to wait days. Now, that's completely dysfunctional, Minister, and that cannot be acceptable. Cannot be acceptable, and I know you don't accept that people can wait days, and that's not an exaggeration. That's a real situation that has happened to many, many people, where they just can't, days, as I said, a long amount of hours in the ED department. So, Minister, in your time left of this administration, this is extremely important to address, and particularly what the Irish Nurses Midwives Organisation have said is that this is the pursuance of staff, safety and patient safety. Thank you.